first lecture is actually about brain-computer interfaces for neurorehabilitation. So we started about 10 years ago with the development of medical products before, and we did research components. Nowadays, we are already using recoveriX for stroke, multiple sclerosis, and also for Parkinson patients. And in the lecture, I will show you how we are doing this. So I'm coming from Schiedlberg. That's a very small village in Austria. This is also where we are doing the recoveriX development. So we are running the research here, and we're also treating patients here up to now. We did already more than 30,000 treatments just in the small village where we are sitting, and patients are just coming here on a daily basis for the treatments. Per day, we do up to 15 treatments, and we have nurses and physiotherapists for performing it. And then we have also an office in Graz. This is actually where the hardware components are assembled. So all our brain-computer interfaces are designed and produced in Austria, and then we ship it to different locations. For example, to our sales office in Albany, New York, taking care of the US market. We have also people working in Barcelona, in Vancouver, in Hong Kong, in Sapporo, in Cali, and also in Newcastle in Australia, actually. The moment we are running about 15 different research projects, and they all have to do with brain-computer interfacing. And of course, they also deal with recoveriX. recoveriX Lag, for example, is a research project where we develop recoveriX especially for gait so that people can move faster, better, to improve balance and much more. So I showed you already the recoveriX video before. That's demonstrating actually that stroke is not only affecting the patient, but the whole family. So the whole family wants that the patient is getting better again. This whole idea is actually going back all the way to Gerd Purcell. He was my PhD supervisor at the University of Technology in Graz. And in the 70s, he came out with the event-related desynchronization principle. So he figured out if a person imagines or performs a left-hand movement, then you get the activation over the right hemisphere. And if the person does a right-hand movement, the activation comes over the left hemisphere. And the nice thing is that these locations are at the same position for every human being. And for that reason, we know exactly where we should place the electrodes to capture the event-related desynchronization or ERD. You can see that Gerd Purcell was plotting the ERD, which is an amplitude attenuation, always in red color. Some people are shifting the colors to blue, but Gerd Purcell's ERD was always red. And then you can see here also the international 1020 system. So this is a system that assigned electrode names to all the different positions. And for capturing left and right hand movement, we have to put electrodes around C3 and C4, left and right hemisphere. And it must be exactly over the sensory motor cortex, otherwise we wouldn't get activation. So if we put, for example, electrodes on the forehead, it would be completely useless to get motor movements. And here you can see the setup. So here we have a patient equipped with the brain-computer interface. In this case, we are using our Nautilus Pro Flexible, which is a medical device. So it's cleared in many countries in the world, in whole Europe, in Canada, in the US, and much more. So this EEG system is measuring data over the sensory motor cortex. We can see here that the electrodes are on the central line. This is C3, CZ, C4 on the other hemisphere, and this is exactly where we need the electrodes. You can also see that here is a little electrode a little bit forward. This is our grounding electrode. So this means the voltage is measured between this ground electrode and all the other electrodes, and so we get the EEG recording. Then in front of the patient is a computer monitor actually giving instruction to the patient, in this case to perform a right hand movement. The person is imagining the movement, the brain-computer interface picks it up, and then we provide electrical stimulation to the right hand muscles so that the dorsiflexion is actually performed. You can see we have two stimulators, so one for the left side and one for the right side. And with that, we can get co-activation of the left and the right hemisphere. And this is actually our first patient that was ever recorded with recoveriX in a clinical study that we were doing. You can see the setup. At this time, we were using the high amp. We had a fast stimulator here with a couple of channels, the computer monitor in front of the patient. And actually, we started with 64 channels because we wanted to figure out how many channels we actually need for running neurorehabilitation efficiently. And this is how the training looked like 10 years ago. Little playback. So here you can see we had a arrow pointing left and right. This is, for example, the instruction to the right-hand side. The patient imagines the right-hand movement. The hand gets stimulated so that the dorsiflexion actually happens. This is randomized between left and right. And this is now the left-hand movement. See also the dorsiflexion here. The affected side is, by the way, the right-hand side because of the stroke. And the patient came into the clinical trial 12 months after the stroke. So after 1 year, every neurologist tells you there will not be any improvement anymore. This is the reason why we wanted to figure out if we can actually achieve something in chronic stroke patients. And here you can actually see the results. So the patient did the 9-hole peg test. In this case, you have to place 9 little sticks into certain positions with the left hand and also with the right hand. And you can see here, when she started with the recoveriX therapy, she needed 31 seconds. This was 1 year after the stroke. And at the end, she needed 29 seconds. So it's a little bit better, but this is the healthy hand. Nevertheless, we see always that also the healthy hand improves. Of course, much more interesting is the paretic hand. So before recoveriX, she needed 1 minute and 5 seconds. After recoveriX, she could do it in 30 seconds. So 30 seconds is considered to be normal. If I record a person with 62 years, it's around 30 seconds. And this is exactly what we want to achieve, that both hands actually have the normal hand function again. We have also a patient interview so that you can actually hear what she's reporting.
Savin, ați avut un accident acum ceva vreme. Cum s-a întâmplat? V-ați așteptat la așa ceva?
Nu. Am ieșit din baie cu ibricul, mână și am căzut și n-am mai știut nimic de mine când am ieșit din baie.
Am înțeles. Deci a căzut și ați
A
rămas
căzut
acolo.
ibricul întâi, eu am vrut să stau pe pat și am căzut.
Și ați căzut pur și simplu.
Și gata, atât.
După ce s-a întâmplat acest AVC, care era condiția dumneavoastră fizică? Cum
Moartă,
simțeați?
legumă, nu puteam să vorbesc. Eram conștientă, știam, nu puteam să vorbesc, nu puteam să mă mișc, nimic.
Deci pur și simplu doar vedeați, gândeați și atât.
Da, vedeam și gândeam. Nu puteam să să zic.
Iar mișcările?
Nu.
Nu vă puteați mișca deloc.
Nu.
Care a fost partea cea mai afectată? Partea dreaptă, am înțeles. Da. Ok. După un timp ați început probabil să și merge, să mișcați și mâna stângă.
După 10 zile.
După 10 zile ați început să vă mișcați totuși, am înțeles.
Un pic, câte un pic.
Doar câte un pic. Dar mâna stângă,
nu.
Mâna dreaptă.
Mâna dreaptă, nu.
Deci mâna dreaptă nu puteați mișca la momentul respectiv.
Mâna dreaptă nu.
Înainte să începeți să lucrați cu sistemul recoveriX, Știați ceva despre reabilitarea cu Brain-Computer Interface?
Nu știam, dar vroiam.
Nu
Totuși
știam.
când a zis domn doctor și dumneavoastră, când a zis, dacă-s de acord, am zis, da, vreau. Eram... Nu...
Am înțeles. Cum a fost experiența dumneavoastră cu recoveriX?
Cum să zic... Eram mulțumită. De-abia așteptam să mai fac și mâine și poi mâine când mă programați.
Vedeați câte un progres de la o zi la alta?
Pentru că îmi puneam așa mâna pe bețșoare, pe... Adică vedeam ceva. Și de-abia așteptam și mâine și poi mâine.
Vedeați câte un progres de la o zi la alta?
Da.
Câte sesiuni ați efectuat cu recoveriX?
24.
24. Am înțeles. Cât de mult s-au îmbunătățit funcțiile motorii ale mâinii dumneavoastră? Poate și puteți arăta cum vă simțiți.
Pentru mine, parcă ar fi 100%. Eu, când mă culcam, nu puteam, trebuie să o mut.
Am înțeles.
Trebuia să mut mâna cu ea slaltă, cu stânga. Dar acum...
Acum vă simțiți foarte bine, o puteți mișca,
Da,
face...
o același... Cum e asta e și asta.
Am înțeles.
Decât mi-e frig așa, o simt. O rece. Dar
Deci o puteți mișca foarte bine, fără
foarte
absolut
bine,
nicio
foarte
problemă.
bine. Car roaba cu e, să prășesc, scot apă din fântână cu e.
Am înțeles. Deci puteți efectua activități zilnice aproape ca înainte.
Da, aproape. Eu aș zice că 100%, că asta ca stânga.
Cum vă simțiți după acest succes?
Am zis să vă dea Dumnezeu sănătate, dumneavoastră. Mă simt bine. Nu, eu știu, o să tăieți. Să vă dea Dumnezeu sănătate, că mă simt super.
Am înțeles.
And this is, of course, exactly what we want to have, that the patient is reporting that everything is possible after the therapy again. And this work was actually done by Danud, who gave already a couple of lectures during spring school. And here you can actually see how the training was done. So we are reporting here the first 21 training sessions. At this time, we reported the classification error. You can see she started with 88% classification accuracy. Then it went down to 5%, was going up and down a little bit. Best session had, for example, roughly 96% classification accuracy. And this was astonishing because we did many BCI tests, of course, performed with students. And on average, we get something like 80%. And we thought it will be much more difficult with stroke patients, but it was actually the opposite. So stroke patients are performing better than students because they are highly motivated to get better. We can also look at common spatial patterns. And here you can see that the centers, for example, here is around C3 and here around C4, but after 13 sessions, for example, the common spatial patterns are better. They are shifting exactly to the centers where we want to have them. And if we look at the linear discriminant analysis that's plotted here, so here are the first few seconds, the patient gets the instruction to imagine left or right hand movement. Then we can see we find a small difference between left and right. Classification accuracy is here around 15%. And in session 13, for example, you can see after the patient gets the instruction, we find a much clearer difference between left and right. The classification accuracy is better. And this shows neuroplasticity. So this is exactly what we want to achieve, to activate the sensory motor cortex again. And this is done by many, many repetitions. So you have to imagine the left and right hand movement just many, many times to produce neuroplasticity. And now 10 years later, we have another setup, which is actually demonstrated here. So this video shows actually an intermediate recoveriX system, because here we were still using the wired active electrode. Later on, you will see that we are using the Nautilus to make it even easier and better. So in this case, we have a stroke patient who had a stroke that affected the right hand. We are nowadays using a Unity environment with an avatar in front of him, telling him what he should actually do. So this is, please imagine a left hand movement. The brain-computer interface picks it up, and then we stimulate the left hand to produce the dorsiflexion. This is more interesting because the right hand is affected. You can still see the spasticity in the index finger. The patient is not fully able to extend all the fingers because of the stroke, but this gets better with every single treatment. And we are doing 120 left-hand movements and 120 right-hand movements. So it sums up to 240 movements in one therapy session. This is how it's running for about 45 minutes. So you can see we made it as easy as possible for the patient to understand what he's supposed to do. In addition, he is also getting verbal commands like left, right, relax. And this is supposed to trigger also mirror neurons because the patient is seeing on the computer screen what's actually going on. And if a person is observing motor behavior, mirror neurons are activated. They're also speaking with the sensory motor cortex, and we are getting more activation. Beside that, we are doing the functional electrical stimulation, which is a standard treatment. We are doing the motor imagery, of course, which is a standard treatment. And we are also doing bilateral training, so left versus right hand, in order to activate both hemispheres. And then we can also look at the outcome of another patient. This was actually a very young patient when she came to the recoveriX therapy, only 38 years. Right-hand side was affected. She came into recoveriX 14 months after the stroke. Her hand was severely affected, and all the doctors told her this will be to the end of her life. So she was unemployed. Before she was a hairdresser, but she couldn't work anymore. And for that reason, she was just at home and couldn't do anything. And then we did 31 training sessions. You can see the classification accuracy started with like 65%, and then it got better and better. Here she reached even 100% classification accuracy. So we see a very nice learning effect. So such a trend is mostly visible for our patients. Then session number 1, you can see here the red vertical line. This is actually the time point when she gets the instruction to imagine left and right hand movement. You can see we almost don't find a difference over the sensory motor cortex between left and right, but after about 1, 2, 3 seconds, we have a nice difference. If you look at session number 1, then you can see the difference between left and right sensory motor cortex activation is much bigger, and it's also much faster. And this shows again neuroplasticity, so the brain learns to do the movement again. We can also look at the event-related desynchronization maps. So this here is the left hemisphere, this here is the right hemisphere. And then you can especially see for the right hand movement, which is the paretic side, which was damaged by the stroke. We only get a little bit of ERDs, the red color, shows brain activation. On the healthy side, we have more ERD, which is normal. This is the alpha region, this is the beta region. And after 31 training sessions, you can see we have much more brain activation on the paretic side, which is outstanding because nobody could tell us until this time if we can activate paretic sides again. And here we just can very nicely show it with the ERD plots. And also on the healthy side, we get more ERDs because also over there, neuroplasticity is happening. And this is exactly what we want to achieve. And we can also use our recoveriX system to pinpoint that. Then we are doing a lot of functional assessments just to figure out how much our patients are getting better. So one of these assessments is the upper extremity Vogel-Meyer score. This is a score which is internationally used by many physiotherapists, physicians for describing motor functions of upper extremities in this case. In blue, you can see the score before recoveriX. In orange or red, you can see it after recoveriX. So the total score, for example, improved from like 56 to like 62, couple of points in Vogelmeier, which is also nice because this is a chronic stroke patient. And we could show that we get a nice Vogelmeier improvement. Just the Vogelmeier score is not very sensitive. So it's very nice to have also other assessments to get a clear picture of what is actually happening. And a very good test is the 9-hole peg test because it measures fine motoric skills. So here on the left-hand side, the healthy side, you can see the patient started with 17 seconds. At the end, in the post-assessment, so after all the recoveriX sessions, she needed only 14 seconds. That's an improvement of 16%. And this is something that we see all the time. Also, the healthy side improves. And of course, this is also very useful for patients. Much more interesting is, of course, the paretic side, in this case, the right one. You can see at the beginning, she needed 7 minutes and 26 seconds. And then it went down to 1 minute and 14 seconds. That's an improvement of 603%. Much, much better hand function. And also interesting is how quick this was going. So I told you before she was 38 years old, she couldn't work anymore. And she was pretty desperate because of that. Social security system was paying the salary. And then she was coming into session 3. And you can see the time is already half of it, 3 minutes, 21 seconds. In session 5, it's already 1 minute and 34 seconds. So within 5 sessions, her hand movements improved a lot. And this is exactly what we want to have. So 5 sessions take about 4 hours of training. And we can say 4 hours of recoveriX training made all the difference for her to get her right hand movement back. So we look also at Patel index. That's a questionnaire of what you can do in daily life. Can you dress yourself? Can you cook? 100 is the full score. This is also typical because many people can just do everything with one healthy hand. Then we look at the Van Tremor scale. Describes how much tremor a patient has, stayed constant in this case, and we look also at the modified Ashworth scale. So this scale tells us how much spasticity the patient has. 4 is the maximum, then the hand looks like that. And you can see the spasticity was reduced from 1.5 to 0.5 for the wrist. So 0.5 is only a little bit of spasticity anymore. 0 would be nothing. And also for the hand, the spasticity improved from 1 point to 0.5. On the left-hand side, we can now see how the recoveriX, the 9-hole peg test, looks after the recoveriX session. So you can see that the 9-hole peg test is actually a very difficult one because you have to get these little pegs inside the hole. Then you have to hold it, you have to rotate the hand, you have to insert it into the little hole by rotating the fingers and the wrist. So it's a very complicated test, really showing fine motor improvements. This is actually a video of her giving a hairdressing to our physiotherapist, Manuela, after recoveriX was completed. So this is the healthy hand. The right hand is the paretic hand. Look, she can nicely do it. And after recoveriX, she was actually able to return to her job, and she reopened her hairdressing institute again and is working again. And this is exactly what we want to have. And also the social security system wants to have that because they don't have to pay for her anymore. And we have also a patient interview from her.
Also erst einmal war der Oberarm komplett taub und die Finger waren, ja, ich möchte nicht sagen steif, aber ich habe es nicht so viel bewegen können wie jetzt. Ja, da einer war ja taub und da 4er, da einer. Nach der 6. hat das angefangen, dass das taube Gefühl vom Oberarm weg gewesen ist, komplett. Und das bei der Hand auch. Ich habe immer gesagt, das ist wieder mehr meine Hand. Also das war zuerst wie so nicht ein Fremdkörper, sondern die hat nichts gemacht. Und jetzt kann ich kann ich viele Sachen machen, was gar nicht gegangen sind. Ich bin Friseurin, ich habe am Anfang gar nichts machen können, ich habe am Föhn nicht holen können, nichts. Das ist immer, das Handgelenk immer so eingefallen. Und jetzt kann ich ja Kopf waschen, wie es gehört, und föhnen auch. Unsere Föhns sind schwer und die kann eine ganze Kundschaft föhnen, 30 Minuten lang, und das Handgelenk ist fest. Ohne dass es runterfällt oder schwach wird, das ist vorher gar nicht gegangen. Ich habe es immer wieder probiert. Ich habe dann den Lebensmut wieder, wenn man sagt, nein, es geht was weiter, und man sieht es und man spürt es selber, dass es besser wird, und die ganze Hand ist schon viel, viel anders jetzt. Nicht ganz wie vorher, aber kommt denn schon ganz neu jetzt.
Die Frau Brandstätter zu uns gekommen ist, hat sie vorwiegend eben von der Sensibilität her was noch eingeschränkt, von der rechten Körperhälfte. Das hat es natürlich auch schwieriger gemacht für feinmotorische Greifübungen und Greiftätigkeit im Alltag. Das hat natürlich sie dann auch beruflich eingeschränkt, weil sie ja Friseurin ist. Aber bei ihr haben wir sehr schnell Fortschritte erkennen dürfen. Schon nach 5, 6 Therapieeinheiten ist einfach die Wahrnehmung viel besser geworden. Sie hat feiner greifen können, schneller greifen können und auch unbewusster greifen können. Also sie hat nicht mehr sich so sehr darauf konzentrieren müssen. Und dadurch hat sie natürlich dann auch in ihrem Beruf wieder große Fortschritte gemacht. Nachdem sie ja, wie man merkt, mit ganzer Leidenschaft Friseurin ist, das ist natürlich ein riesen Rückgewinn von Lebensqualität, den sie dadurch gekriegt hat.
This is all going back to Dr. Donald Alding Hepp, because he is described the neuroplasticity first, and he came up with if neurons fire together, they wire together. And he's actually a doctor. He was a family doctor from Halifax in Canada. And interestingly, Adam Hepp is a very good friend, and he was already giving a very nice keynote lecture here at Spring School. And by coincidence, I figured out that he is actually the nephew of the Adam Alding Hepp, because he's also called Alding. So it took us some time to get this sorted out. Let's look at patients who are in the subacute step phase. So here's a male patient who was 79 years old. Right-hand side was affected, and he came after 4 months into the recoveriX training. You can see we did 25 sessions. Classification accuracy was around 80%, going a little bit up and down. In principle, okay. We can also see in session number 1, he needed about 1-2 seconds so that we find the difference. In session 1, it's fluctuating a little bit, but we can find the difference. So we get also more brain activation. In the Vogel-Meyer for upper extremity, we can see we gain about 5 points, but the 9-hole peg test for him is also very interesting. So the left hand improved from 36 seconds to 28. Nice improvement of 8 seconds, also very useful for older patients. And the right-hand side, for example, started with 56 seconds. At the end, we have 35, improvement of 63%. Of course, if somebody starts with about a minute, we cannot reach 600% improvement anymore. But 35 seconds for a person who is almost 80 years old is pretty normal. Then we can also see an improvement in spasticity in the wrist and in the hand. And first of all, always the spasticity has to go away, and then the fine and gross motoric skills are coming back. And these numbers are very abstract. And that's the reason why I show you videos so that you understand what it means. So on the left-hand side, you can see the hand movement before recoveriX. And on the right-hand side, you can see it after recoveriX. You can see the movement is faster and wider. And here we were asking him to touch his nose before recoveriX. And this is after recoveriX. You see, this looks like another person doing the movement. I show it you again, before recoveriX, after recoveriX. So if I see the video on the right-hand side, it looks normal, isn't it? This is exactly what we want to achieve. We have also a patient interview from him.
Fast nichts. Ist der Schlaganfall gegangen, haben nur einmal gedacht, beim Gehen, wie schlank man kann, wie es oft geht, dann geht es nicht. Es muss da hängen bleiben. Das war alles. Danach wollte ich dann einmal aufstehen, aber der Fuß nicht mehr da. Das Krankenhaus, da haben sie festgestellt, ein Schlaganfall. Und es war dann der mittlere Finger, alle so angekommen bin und dann wieder aufgesprungen, weil es so nicht da. Aber ich war dann so, über den Schlaganfall kannst du nicht ändern und da habe ich immer geschaut, dass ich positiv bin. Weil ich keinen Bleistift halten kann. Und gespielt habe ich es weggerutscht. Aber es ist immer besser geworden. So, dann habe ich mich gefragt, dass es so weit geht, dann habe ich mich gefragt, das gibt es nicht, das ist so weit. Und dann kann man mal bis zum Mond so und da sowas, dann immer besser werden. Also die Hand ist beweglicher geworden, das ist klar, viel Übungen dazu. Was ich gemacht habe, aber vorher überhaupt nicht geht. Und Gott sei Dank keine Schmerzen. Freiwillig. Wieder herkommen bin und das hat wieder funktioniert. Das war schöne Erfolge.
Ja, als der Herr Steiner zu uns gekommen ist, hat er schon eigentlich relativ viele Sachen wieder können. Es hat eher Kleinigkeiten, die was eigentlich ausbaufähig waren. Die Feinmotorik, einfach das gezielte Bewegen, auch die Kraftdosierung. Das ist dann eigentlich auch im Laufe der Zeit mit der Therapie immer besser gelungen. Wir haben zum Beispiel den Einholbecktest. Da hat er sich von ungefähr einer Minute auf ungefähr eine halbe Minute verbessert. Gezielter Griffen waren in der Hand. Die Stabal viel besser und viel schneller tragen, viel selbstsicherer. Es ist ungefähr ein halbes Jahr, war jetzt Pause nach Therapieabschluss. Die Verbesserungen, die wir erreichen können haben, die haben wir auch erhalten können, vollständig. Es ist sogar teilweise sogar noch ein bisschen besser. Die betroffene Hand ist wieder gleich gut war wie die gesunde Hand. Durch das wir auch sehr viel erreichen können.
Very nice. Here's also another very interesting case. Middle age, 53-year-old male, right side affected 11 months after the stroke. Same story. All the doctors told him there will not be any improvement. Here we can see the classification accuracy over 25 training sessions. Started again with around 65, and then he went up pretty early to a couple of times 100%. So this is what we get only very seldomly with students because patients are highly motivated. And then we can also see here in session number 1 that the sensorimotor cortex needs about 1.5 seconds to get activated. We find a smaller difference. And after 25 sessions, we find a much bigger difference. You can also see that on the paretic side, we get more event-related desynchronization. Also on the healthy side, shows again the neuroplasticity. And the outstanding for him is actually that we got, I think it was 26 points improvement in Vogel-Meyer assessment, which is a lot for 18 hours of training. You can also see the Patel index of doing daily activities improved. He had less tremor, less spasticity in the wrist, and less spasticity also in the hand. And super interesting for him is that we actually didn't find any improvement for the first 17 sessions. And this is also the reason why we are doing 25 sessions, because we sometimes don't find improvements beforehand. And then it becomes interesting. So in session 18, he could actually finish the 9-hole peg test in 10 minutes, which is a very long time. You can see in session 20, he still needed 13 minutes. And then it went very quickly down all the way to 2 minutes, 53 seconds. That's an improvement of 359% in only 7 sessions. So this means 8 hours of his life made all the difference, but we didn't find improvements beforehand. And that's the reason why it's also important to continue. So 10 sessions are maybe not enough, or 20 sessions are maybe not enough. But if we do 25 sessions, then we find basically an improvement for everybody. This is also the video showing the 9-hole peg test, but you know already it. So I show you this video before and afterwards.
Super. Genau so.
So on the left-hand side, you can see he can do 90 degrees. On the right-hand side, he can do a full rotation, which is almost 180 degrees.
Einmal geht's noch.
On the bottom,
Oberkörper bleibt gerade.
you can see he's
Genau.
touching his nose.
Und wieder oben durch.
And it's difficult for him to
Genau.
extend
Drücken.
the hand because of spasticity. On the right-hand side, you can see he can fully extend the hand. The movement is much faster, all the way up to the nose and down again. So much less spasticity, much better movement. This is what
Super.
26 points in Vogelmeier mean. Then we had one patient who was outstanding in terms of accuracy. So look at that grand average accuracy, 99%. Just perfect motor movement imagination. This was 3 years after the stroke. Very nice. This is the movement. Sorry, this is post. This is pre. This is post. Let's look at all of them. So this is before recoveriX on the left-hand side. And on the right-hand side, we have post 1, which is right after recoveriX is finished. And post 3 is 6 months later. Also having a lot of fun doing the assessment. But you can see before recoveriX how difficult it is. So the other hand is not allowed to help. This is considered cheating.
Ja, weil ich merke, glaube ich, die Finger.
And we already know that after recoveriX, the hand movement is better, but super interesting is also that 6 months later, the hand is even better. So we have long-lasting effects, so this improvement doesn't go away after recoveriX is terminated anymore. It stays there. As you can see here nicely in the video. So 6 months later, she is now finished. And you can see right after recoveriX, she could do 3 bags in the same time. And afterwards, you have to remove it again. The last one was a mistake, but you see it's 6 months later much better. This is also what we tell patients: don't give up after recoveriX, because it's very likely that 6 months later you're better again. This is of course super important that it doesn't go away. Many patients, not many, but a few patients get Botox for the spasticity so that the pain is reduced. And after recoveriX, they don't need Botox anymore. Here's another patient, 54 years old. The left side was affected. And this was 30 years after her stroke. So a very, very long time afterwards. So all the doctors told her as well, there will not be any improvement. Mean accuracy around 71%. You can see in session 1, there's a little difference. In session 25, there's much more difference between left and right hand movement imagination. And for her, the results are super interesting. So she couldn't do the 9-hole peg test at the beginning. Then after the first session, she needed more than 1 hour to complete it. And this shows also how motivated she was. After 11 sessions, 1 hour. After 21 sessions, 1 hour to do the test. And interesting is now after recoveriX was finished, 25 sessions, she could do it in 17 minutes. 1 month later, she could do it in 16 minutes. 6 months later, she could do it in 5 minutes. Shows again the after recoveriX effect. So when they are done with recoveriX, the brain is healthier, then they start to use the hand more in daily life. So they get also muscle training. And 6 months later, people are better. And here you can also see that the Patel index improved, the tremor was removed or reduced, the Ashworth scale spasticity in the fingers stayed constant, but the spasticity in the wrist got much better. And also we have a 2-point discrimination test where sensitivity improved. And this is how we are measuring tremor. So the patient has to draw a line inside here with the left hand and also with the right hand. So you can nicely see here the healthy hand, the line is pretty smooth. And for the paretic hand, it looks a little bit uglier. And then it gets more difficult, so the drawing is much smaller. Here you can see also that it's much uglier for the affected side. Then you have to draw a straight line. So left hand is worse than the right hand. And after recoveriX, you can see the left hand drawing gets much better, even for the small one. And also the straight line is better. So this is how tremor is actually measured. And if you look at the Vogel-Meyer assessment, this is also super interesting over the whole therapy of 9 months. So you can see we do the pre-testing before recoveriX, and then we measure Vogel-Meyer for upper extremity, for the wrist, for the hand. We measure coordination and speed, and this is all summed up to 17 points in total. Then we did 25 training sessions, and right afterwards, so this is 2 months later, we are doing the Vogel-Meyer again. And you can see the total score went up from 17 to 28. So 11 points improvement is a lot already in Vogel-Meyer. And the training just lasts like 16 hours. So it's not really long. If you are learning English after 16 hours, no, you're not really better. This is 1 month later. Vogel-Meyer went up to 35 points. This is 6 months later. Vogel-Meyer went up to 37 out of 66 points, which is the maximum. So from the beginning to the end, we had an improvement of 20 points. Sensitivity was also reduced, and you could see after recoveriX it was normal. 12 points is the maximum. Passive joint mobility was beforehand 19. After recoveriX, even a little bit slower, but 6 months later, 22 points of 24, almost normal. And joint pain, this is also super interesting. Beforehand, she had pain, and afterwards, 24 is pain-free. So pain 6 months later was a little bit there. It's of course fluctuating on a daily basis also, but it also improved. And this is also what we see very often, that pain, chronic pain improves with recoveriX treatment. This is actually one of our patients who had a stroke that affected the right hand. She did the recoveriX training, and afterwards he was so happy that he gave us a little concert here at g.tec.
Das ist wieder ein großes Problem. So. Sollte so.
So much better than when I'm playing, and you could see he was smiling again. And this led also to a couple of case reports in Finland, because also in Finland our physiotherapists figured out that it can be applied for chronic pain. One of these papers, for example, is about a man who had spinal cord surgery, and afterwards there was a lot of pain. So he reported that he had 8 points out of 10 on the pain scale. It was chronic, so medication didn't help. And then they did 3 recoveriX treatments per week for 12 weeks. And afterwards, the pain declined to 1 point out of 10. So this means we have also a positive effect on the pain network in the brain. And this is super interesting. You can also read the paper about it. And they are just very often using it now in Finland for chronic pain treatment. So if medication doesn't help anymore, physicians are sending patients to a recoveriX center to do it. And of course, interesting is also what happens in the acute state. And here we are working together with Asarikawa Medical University. This is a video from Dr. Kamada, and he studied a very young male patient on the day of the stroke, and he recorded a video, which we can see here. And then they applied one recoveriX session. So this before recoveriX, on the day the man, 18 years old, had the stroke. You can see he can open and close the fingers, but it's actually very slow. But it's a good sign if a patient can still do it. And then they did one recoveriX session. The patient slept for one night, and then they recorded the video again. And you can clearly see the difference. So the hand movement is much, much faster, much, much better. And now we are studying how much this is spontaneous recovery, how much this is recoveriX. Because if recoveriX has an effect for acute patients, then of course you should apply recoveriX as soon as possible. It's just much more difficult to prove that this is a recoveriX effect, because there's also spontaneous recovery. So in chronic stroke patients, it's much easier because they don't improve anymore if they are not doing something. And then we were also looking at the accuracy that we achieve with recoveriX. And here you can actually see the outcome. So the main message is if the classification accuracy of the brain-computer interface is above 80%, then we get the Vogel-Meyer improvement of 6.5 points. If the accuracy is below 80%, then we get 2.25%. This shows with higher classification accuracy, Vogel-Meyer improvements are better. And then we can also look at patients who are mildly impaired, moderately impaired, or severely impaired. We can see here that mildly impaired patients improve between or above. If they are above 80%, they improve 6.5 points. If they are below 80%, they improve 4.5 points. But here for mildly impaired patients, we have, of course, also a ceiling effect, because sometimes you cannot even reach more than 4, 5, or 6 points. For moderately impaired patients, it's around 7.5, 7.25 points. So it's not so important if you're above or below 80%. But for severely impaired patients, we can see if they're above 80%, we get 6.75 Vogel-Meyer points improvement, which is very nice. And if they're below 80%, it's only 1.25%. So classification accuracy is super important. So patients have to participate in the training to improve. And if we tell these patients, then they are super motivated to do more and they participate. And here's a patient from Vorarlberg who was treated in Lindau. These are one of our franchise centers in Germany. And you can see on the left-hand side the 9-hole peg test before recoveriX was done, and on the right-hand side afterwards. So removing bags is of course much easier than putting them in, because you have to get them between your fingers first, then you have to hold them, you have to rotate your wrist, your hand, you have to stick it in, and you're actually not allowed to use the healthy hand. Now Matthias lost one from the table. But you can also see here how difficult it is to do this test if you had a stroke before. And of course, there are also many patients who cannot do the test at all because the spasticity and the hand movements are very bad. Now he's done after recoveriX, you see. On the left-hand side, he had only one peg in. Makes a huge difference in daily life. And of course, the question is what happens if somebody does it twice? This is shown here by a very young patient, about 30 years old. On top, you can see the 9-hole peg test before recoveriX. In the middle, we see it after 25 sessions. On the bottom, we see it after 50 sessions. So I start the video. On top, you can see again how difficult it is to get the pegs. In the middle, 2 pegs are already inserted. On the bottom, peg 4 is already completed. So already after 25 sessions, she is much faster. After 50 sessions, it's again much better. So on top, she is still working with peg number 4. On the bottom, she is finished. Now she is removing pegs. This looks like a healthy person. There's no difference anymore. So this requires also sensitivity to do it so quick. In the middle, after 25 sessions, she is now starting with removing it. It's a little bit slower, as you can see. And in the top video, she's still working on peg number 6. So it's a clear improvement. And we can say after 50 sessions, this was about 40 hours of work. Actually, it's 36 hours, and this is not even a working week. So it doesn't matter if a patient invests 50 sessions to get better. This, of course, a couple of years after the stroke. So she started 2.5 years after the stroke with recoveriX. Everybody told her there will not be any improvement. And again, the improvements are long lasting, so they stay. This is another patient who did 50 therapies, in this case, subacute state. So he was in the hospital after the stroke, then he was in the Neurorehabilitation Center. So they applied all technology and treatments which are state of the art. After 6 months, he was released. And again, all the physicians told him this is the result. Then we started with recoveriX. You already know it. On top, it's before recoveriX. In the middle, it's after 25 sessions. At the bottom, it's after 50 sessions. You can see again how slow it is on top. On the bottom, it's much, much faster. So he is already working on peg number 8. On top, he has one peg inserted. So all pegs in. On the bottom, he removes it. You can see he has a very nice fine motoric way of doing it. He moves nicely the hand. So I wouldn't see anymore that this patient had a stroke because the hand movement just looks nice. In the middle, it looks slower. Now he lost one. So he has to redo it again. And on the top, he's still working. You can also see that he has to use the upper body to shift in the pegs because the arm is not good enough. So in total, he improved from 144 seconds to 39. Mentioned it before, normal scale would be around 30 seconds. So I need the 9-hole peg test to figure out that he is actually slower than a normal person. Just by watching, I wouldn't see it anymore. So we did also a clinical study, and we can see that we have a highly significant improvement of spasticity in the wrist and fingers, p-value 0.01. This means it works like for everybody. And also the Vogelmeier upper extremity improved, highly significant. This is exactly what we want to have, and this is also published in Frontiers in Neuroscience. So if you're interested, just go to our Frontiers account, download it, and check it out. And then we figured out that many of our stroke patients have also problems with gait. And so we needed a solution to treat also the legs and feet. And we came up with this avatar, which shows actually the body like in a mirror, so that the patient can see himself, and then we can treat one leg versus the contralateral hand. So in this case, we are using the g.Nautilus to have a wireless interface to acquire the EEG data, and we have one stimulator for stimulation electrodes that we fix on the leg, so to produce a kind of dorsiflexion of the foot. And here you can see also the animation of the avatar. We have the little arrow indicating that he should do it. And then we have a little item, a ball above the feet, so that he should actually lift the foot to touch it. Here you can see the nerves and the muscles where we are putting on the fast stimulation to get this ankle dorsiflexion. User interface will be shown afterwards by Sebastian and Wosi. In general, we can select in recoveriX if you want to stimulate left hand versus right hand, or one hand versus the contralateral foot, or exactly the opposite, the other foot versus the other hand. And this is how the setup for the lower extremity treatment looks like. So here's the physiotherapist. Here's the patient equipped with the g.Nautilus Pro Flexible. We're doing the recordings over the sensorimotor cortex. And here you can see the stimulation electrodes on the left leg and also the stimulation electrodes on the right hand. Now he gets the instruction to imagine a foot movement. BCI system picks it up, and then the stimulation of the leg occurs. You can see that he's only getting a little bit of leg movement because there's still a lot of spasticity in the leg. Hand movement is normal. This is randomly repeated between left and right. And the patient is carefully imagining the hand movements. Another leg movement that you can see here. So he's trying also with the avatar to touch the ball. And then this system says relax. Patient is not doing anything, and then he imagines the right hand movement again. So again, we are doing this to activate both hemispheres to have a better coordination of movements at the end. And here's a result outcome of one patient from Austria who was treated with the leg therapy. On the left, you can see it before recoveriX. On the right, you can see it after recoveriX. I start the video. Our physiotherapist gives some instructions, and then you can see on the left, he started a little bit earlier, and he's just moving faster after recoveriX, and can also sit down faster. If you look at the time up and go test, so in this case, people have to stand up, make a little circle, sit down again. You can see he started with 14, 13 seconds in the pre-assessment. So these are two assessments before recoveriX, and then it was going all the way down to 11 seconds, which is a nice result. It's almost the same as a healthy person. And then the 10-meter walking test shows also a very nice improvement. He started with 9 seconds, and at the end he needed 6 seconds, like a normal person. Also very nicely demonstrated in the video. Here's another patient who came a couple of years after the stroke into the recoveriX clinical trial. On the left before recoveriX, on the right after recoveriX. Here you can nicely see again that she is much faster. Watch carefully when she's sitting down. Nice movement. And watch the sitting down on the left. Still looks like a patient. I play it again so that you can fully observe it. So she jumps up much better. Her speed is much better, more confident, less tremor, can do the circle much faster. Watch again for the sitting down. Very good movement. On the left, she looks like a patient. Maybe somebody has spotted the best thing. She didn't need the walking stick or the crutch anymore. On the right, she just forgot it. And this is exactly what we want to have, that people forget the walking stick or the rollator, whatever they use, because they are so confident that they don't use it anymore. This is a therapy report that patients are getting. So we are showing the number of sessions, the current average classification accuracy, in this case 96%, Montreal Cognitive Assessment, if somebody does the MOCA test, modified Ashworth scale shows improvement of spasticity. Vogel-Meyer assessment went, for example, up from 53 points to 54, very nice 11 points. Vogel-Meyer improvement for lower extremities, time up and go test started, for example, with 26 seconds. After recoveriX, it was 15.9. 10-meter walking test was before 7.6, after 6.4, and also Patel index improved. And then we have remarks like does not need a walking stick anymore. Speed is much better. Walking endurance improved. So before recoveriX, she could do 300 meters. After recoveriX, she could do 1 kilometer. So altogether, very nice improvement. We hand it over to the patient, and they can also show it to the physicians or family members. And this makes, of course, a very high difference. And then we have, for the clinical studies, a lot of different assessments we do. Modified Ashworth scale for spasticity in the knee and ankle. We have video recordings before and after. Time up and go test, 10-meter walking test for speed. Stroop color word test, that's a concentration performance test. So we see very often improvements in concentration, memory. Then we have range of motion in the ankle and in the knee, and the Patel index for daily activities. And here you can see the impressive results. So spasticity improved, highly significant. Time up and go test improved with a p-value of 0.001, like for everybody. 10-meter walking speed improved for everybody. Concentration performance is highly significant, but not everybody improved, for the simple fact that not everybody has problems with concentration and memory. Range of motion in the ankle, nicely significant. In the knee, nicely significant. And Patel index improved, also significant. And here you have to remember again, not everybody has problems with range of motion, so not everybody can improve. So we find a very positive effect. And then we compared it with 4,458 other patients in other controlled studies. And in the best case, electromechanical training with end effector training is done. And they get 0.11 meters per second gait speed improvement. With recoveriX, we get 0.19 meters per second improvement, so much more improvement. This is just very nice because patients in our case can sit, so they don't have to put into a body weight support machine. You don't need 3 physiotherapists for doing it. Actually, 1 physiotherapist can take care of 3 patients at the same time. For that reason, it's safer, cheaper, and it's also a medical product in many states around the world already. So we have clearance in whole Europe, in Canada, for example, in Australia, in Singapore, and New Zealand, and many more states. And we can also look at the results of the American Stroke Association, but this is something that I'm showing you after the demo session that Sebastian and Wosi are doing now.